A big survey published out today shows that less than a quarter of us apparently are happy with the NHS, the worst satisfaction rates now since records began. Lots of you have been getting in touch. Jack says, Michelle, I had 2 heart attacks last year. The ambulance arrived within 15 minutes. I was straight into treatment. He says, Blackpool, Victoria is fantastic. He says, thank you to all of you for saving my life. And I've got to say, I've got quite a few positive stories about the NHS coming in. Are you satisfied with the way it's going, Jacqueline, at the moment, or not?
No, I'm not satisfied with the way it's going. But I would agree with the caller or the email. I have friends who are actually surgeons who are frontline in the NHS and others I know who are nurses. And I don't think the criticism is predominantly with a lot of people at work in the NHS, particularly frontline. I think we have some of the best in the world and they are magnificent. The structure has become more and more of a problem, I think, over the last years. And it can't keep up, really, with the demand. So I think that the bureaucracy, what they say to me is that the bureaucracy that they deal with now when they're just trying to do their normal jobs has sort of escalated beyond whatever in terms of then the amount of paperwork they're filling in, the amount of emails they're having to check, the amount of people then running a department which, you know, has a manager with a manager. And there are about, I think, three quarters of a million, if you'd say managers, administrators in the NHS, there's about 1.4 million people work there. And also there's an issue, I think, with the calibre of some of those, certainly managerial, the calibre working on the operational side who don't seem to be up to the job. You can, by all means, you can criticise governments, and we always have to take that criticism. But by the same token, the NHS themselves, the trust themselves, we're paying chief execs a lot of money to run these hospitals. Some of them are appalling, some of them are very good, and they just vary throughout the country. And I think one of the main issues is getting past the GP. Once you are in there, the treatment can be absolutely excellent. But I think we've got a massive problem with the whole of the front line in terms of GP practices. Let's have a look at some of these key targets as well. I can just bring that up on the screen just to give you some examples of what's going well and what's perhaps not. I mean, get your magnifying glasses out, ladies and gents. In England, the last time the 4-hour A&E wait was hit was July 2015. In Northern Ireland, that's never been reached. In Scotland, that was last met in July 2020. In Wales, it's never been reached, that 4-hour A&E target. We're giving you some cancer, 62-day cancer targets there. Again, they don't look great. And so on it goes. Bronwyn says, Michelle, can I say, I've moved up to the Doncaster area and I can't fault the service I've had from the NHS, particularly the GP service I'm signed up for. She says, I think the overall problem with NHS is poor management and waste. They seem to get away with everything because it's too easy to blame the government, she says. Aaron, where are you?
I think part of the answer is it's very patchy and people are more likely to remember and recall and bring up a bad experience rather than a good one. You can have 4 great experiences. If you have one very bad one, that's what's going to stick in your mind. I agree with many of the points made around management. I think it's a problem actually in the public sector too often that we have the worst the private sector, we have the worst the public sector. I see it in local government all the time in stories with local authorities. Somebody will be the head of regeneration in a certain council and you look at the place and think, well, it needs some regenerating. Why is that person on 150 grand a year? What are they being judged on? How have they still got a job? So I agree with a lot of that. What I would say is what's really interesting with the NHS is that after 2010, through to about 2018-19, you could make, and you disagree with this, I'm sure, you could make an argument that, there'd been cuts into austerity, but the service was still pretty good. But, on various measures, it had gone down. What's fascinating is that since COVID, actually a ton of money has been spent on the NHS, a ton. I say this as somebody on the left. And actually, the outcomes are getting worse, not better.
So why do you think that is then?
Well, that's the $64 million question. It's a really interesting, I mean, if it weren't literal lives at stake, it would be interesting, but it's a really sophisticated, difficult problem. The government is spending the money, but it's not leading to better outcomes right now.
Which I find interesting because, right, people were asked, would you want to pay more money for the NHS? And I found it quite interesting, the amount of people that said they would be willing to spend more, so actually be taxed more, if it meant direct spending more on the NHS. Well, I wouldn't want to spend a penny more on the NHS until I was clear that the efficiencies were kind of optimised, that you were running as best as you possibly could, that you don't have wastage, that your outcomes are the best they can be. Only then, when I knew that was right and already, would I spend any more in tax given the choice on the NHS?
Well, you shouldn't have to spend any more on the NHS. We are spending hundreds of billions on the NHS, and you made a good point. A bucket full of money was put in. But what you did mention was key, I think. And as I'd mentioned a bit earlier, talking about the GPs, that the access to your GP before COVID was much easier. And during COVID, of course, that stopped. And in some practices, it stopped. It was stopped by people couldn't even virtually get a phone call. And unfortunately, that's still going on. Now, if you cannot get an appointment, it's all very well saying, well, you can have a word with the receptionist or you can have a word with whatever. It's not the same thing. Doctors train for years because they're looking for certain things. And it doesn't mean to say if we go and see a nurse practitioner because we're having a jab, that's perfectly fine. But there are only certain levels of things that they are going to diagnose. And I think until the frontline in terms of GP practices are sorted out, and they're not left short of money. They have plenty of funding, quite frankly. There are some that are very good, but there are too many, and I know people, and they're having a horrendous time trying to see a doctor, and they genuinely do need to see the doctor. I think what we're trying to do, which is quite good, is look at how pharmacists can come in on all of this.
Great policy, yeah.
Pharmacists, I think this is a great policy. We have great pharmacists. They're highly trained in this country. They know more about drugs than most of the doctors put together. And they will always refer you back to your doctor if they think that there is something that's looking not great. But a pharmacist can quite often come up with a solution to save that time for you going to a doctor or even going to A&E.
Yeah.
I don't want to be too controversial, so I'm going to pick my words carefully. But do you think that we've got... I know I'm trying really hard. I'm trying really hard. You watch it come out all wrong. What I'm trying to get at is the NHS, to me, you're supposed to be there to try and save lives, prolong a good, healthy standard of living. Now, it seems to me that the NHS is being used for everything. And again, I'm trying to pick my words carefully. Whether it was trying to indulge children who think that they're an opposite sex, whether it's trying to give same-sex couples IVF, and so on and so forth. There are so many different things now that are not related to how do we, stop somebody from dying, how do we give someone a healthy standard of living. We've kind of gone off on all these different tangents.
So do you think IVF should be
Well, I don't know.
For a heterosexual
I don't know,
couple?
and I sit there and I think, maybe we need to have some really harsh conversations about what is the NHS actually for. What is it? Is it for all of these kind of things, such as, IVF treatments? Is it for, in some cases, cosmetic things? In some cases, helping children transition or whatever? Is it for that?
Well, the children's transitioning point, people can agree or disagree. That is a tiny number of operations, but the IVF
It's a direction of travel.
Sure,
it's a scope of services.
I mean, IVF is
whether or not it should be.
IVF is a lot of money. That's an important point, and it's a fascinating question. Obviously,
but should it be used for that?
Well, what I would say is your question about we need to actually think fundamentally about the kinds of things we're looking to offer, I think, is absolutely the right one. Again, I'm coming at this from the left. I would like to increase capital gains tax. I'd probably like to reduce VAT. But broadly speaking, the NHS, like you said, is about £140 billion. It's a lot of money. It's a lot of money, and it should be getting better outcomes. And I think we probably do need a conversation in this country. We were talking about child protection a moment ago. I think it should have more money. That's not necessarily to give the social workers more pay. We need more social workers. We need more people because they're overstretched. That's the sort of thing which needs more resources. There are other things which need more resources, but then we're going to have difficult conversations about,
let's try and have a very difficult conversation.
What does the state not
should
do?
the NHS be there for IVF? Let's pick that as a strand.
Yeah, can I just...
No, I want him to answer it. What's your thoughts?
I would have to see the numbers. I'd have to see the numbers. I don't know. But also, we've got low birth rates. I mean, that's a counter argument.
That is true. That is very true. What do you think?
Well, I think there are people who will have a medical issue and would like to have a family. And I don't think there's anything wrong with that at all. And I think you're talking relatively small numbers in the scheme of things. And therefore, I would expect the NHS, I mean, if they can go private, fine. A lot of people do go private, actually, for IVF treatment. But if they can be helped to get pregnant and have a baby, I'm quite OK with that. Because I think if we start to focus just on some smaller groups, we lose where we are.
Maybe because I was trying to be diplomatic at my wedding, it might not have come across. What I'm saying is...
Maybe if people have already got maybe 1 or 2 children and then they want to get another child and then they need IVF, maybe you should pay for it themselves. If you see what I mean.
I've maybe picked on 2 kind of specialist niche things. But I guess the central point of what I'm saying is, do we need to go right back to basics, look at the NHS and go, right, what is the purpose of the NHS? What is it actually for? Is it for any ailment, for anyone? So, like, for example, if you are someone who insists on taking drugs and then you get support with your detox and all the rest of it, and then off you go back again and you take drugs and back through detox you go and around and around and around, should there be cut-offs? I mean, maybe I'm going too niche in my questioning.
No, because they're clogging up A&E. And you'll get people who are drunk, and I mean not drunk occasionally, but they're picking them up because they're drunk and they're in A&E because that's where they have to take them at times. But the key problem with the NHS, it was set up for the right reasons. It really was. But a health service should be proactive and not reactive. And the problem with the NHS, everything is reactive. It should be focusing more like they do in continental Europe. And there aren't NHSs in continental Europe. I've lived in 4 countries. And they're all insurance-based, or there is a very small part of the pie if people don't earn anything. But it's funded privately. They're funded privately. People don't wait more than 24 hours for a GP appointment. The service that they get is very good. And that's across the piece. And that's generally with that sort of model that they use. I think that we're going to have to, with the size of the population and the demands, we're going to have to start thinking seriously cross-party, having proper conversations, which we never, ever do with the NHS, of seeing how we can actually restructure this service so it can actually do the job that we'd like it to do.
The challenge that you've got there is almost like the NHS is like some kind of religion.
It needs to stop.
And we've got to people almost worship it. And if you even try, and this is why I don't know if there's any politicians that have got the chops, really, because you need, I think, to have really difficult conversations where you go back to basics and you literally sit there and go, look, what we've got isn't working. I think everyone can see that. So it's not working. So what does the future look like?
But it's one of the few things which the taxpayer gets. It goes, I'm paying my taxes, I get this, schools for your kids, NHS, pensions.
Yeah.
And people pay a hell of a lot of tax. And if all of a sudden somebody says, actually, let's privatise this, they say, well, hold on a second.
I wasn't suggesting privatisation.
I know you're not saying that, but it's on the one hand, there is the whole religion of the NHS, that's true, but it's also one of the very few things which people think, well, my taxes are paying for that, and I can see it, and I engage with it, and I use it, every couple of years.
But if you can't access it, what good is it?
More and more people are taking out health insurance now.
Sure.
And more people now, they just get into a point where they haven't got anything that's going to kill them, but they've got debilitating issues, and they can't get back to work. So they're actually finding the money to make appointments.
I just want to give a few shout-outs because I know that so many people on the front line work really hard. Darren says, I had an op yesterday in Royal Hallamshire Hospital, Sheffield. He says it was all excellent and he wants to say a big thank you to all of the team that looked after him. One of my viewers here, she says she's got kidney problems, Sally, kidney patient for 25 years, and I've had fantastic care from Hull Royal and Castle Hill. A big shout-out to all of those guys. Lots and lots. It's actually quite heartwarming, actually, because so many of you are getting in touch to share your positive stories, which is really nice. Penny, though, says, I cannot get in to see a GP for love nor money. There you go.